Let me ask Bob a question. During the campaign, much was made about Paul Ryan's plan for Medicare. And it seems now to have gone by the board. Some people say that the campaign made the political climate surrounding that policy proposal too toxic to go forward. Do you think that there is a chance that it can succeed at some point in the future?
First, it's important for students to know professors admit they were wrong. I happen to be quite wrong on this issue. So I happen to be quite quoted early saying that this was going to be a winning strategy for Nancy Pelosi to take the House back for Democratic Party by basically emphasizing in millions of dollars of ads how this change in Medicare would not be the best interest for long-term people, long-term retirees. It turns out every poll, it doesn't matter how you described it, finds people do not like the idea. Okay? Why was I wrong, etc.? Basically, not a single older person changed their mind to vote. Governor Romney won the majority of people over age 65 across the board and in Florida. And if you were in Florida, you were sweating by grandma being pushed over the side about this proposal. What that is going to say to Republican policymakers are, we lost, Obama gets his Medicare, that's where we're going. But if we come back someday, it's wrong. Don't tell us that we can't have the House or the presidency because of this bill. It didn't work out that way. My view is you will see Paul Ryan's type proposal reemerge, not in this administration, in the next presidential campaign, because it did not move voters the way people like myself thought it would have.
That's fascinating.
And I'd love to add that this idea of a voucher or premium support or defined benefits originally happened was a proposal of a left-leaning group of people originally and has over time been embraced by lots of different people across the political spectrum. And it's associated most strongly with Ryan now, but I think there's some strong underlying economic arguments that suggest it's not such a bad way to go, and that the generosity of the plan very much affects winners and losers and how current seniors would fare, but that you could dial a plan that's structured like that up or down and have very different distributional effects while trying to improve the efficiency of delivery. So I hope that the fundamental idea doesn't die and will come back in one form or another, maybe proposed by a very different group of people.
What are the underlying economic arguments in favor of it?
Well, it goes back to the point that I was making earlier about Medicare paying for a virtually unlimited set of benefits on a fee-for-service basis. Right now, about 75% of Medicare beneficiaries are in a fee-for-service plan where any care that's covered by Medicare is reimbursed, regardless of how much it improves health relative to a less costly alternative. And to me, that seems unsustainable over the long run, in part because of the miracle of modern medical innovation. It's wonderful that we have all of these new treatments, but there's no way that our public programs can afford in the long run to pay for all care for all people, because that would be more than 100% of GDP, and we also like food and shelter and roads and things like that. So once you're going to preserve some of the budget for other things, you have to make some tough decisions about what to cover. And one way to do that is to say we're going to ensure a basic set of benefits for everyone, and then let higher income people buy more things that are progressively less and less effective if they so choose. And one mechanism for implementing that is a fixed benefit that everyone gets, in the form of a voucher, in the form of a public program. There are lots of manifestations of that. But the fundamental idea is that by guaranteeing a basic package for everyone, the public program becomes affordable while not restricting people who have the ability to pay for more from buying as much medical care as they would like.